A 10-year-old Jersey cross. I know. So the reason why she has this fistula in, it was put in 2002, and it's so we can take rumen samples from her. So cows and other ruminants such as sheep, goats, llamas, alpacas, they have what's called a ruminant digestive tract, and it has 4 chambers to their stomach, the first of which is the rumen. And the rumen has all the bugs and bacteria, the good bugs, that are needed to digest the hay and other material that they eat, which we can't digest. So what happens is we get sick ruminants in our hospital who haven't been eating for a couple of days, and all of their bugs in their rumen die, and their digestive tract basically shuts down. So without all of those bugs, they can't digest any of their food. Even if they eat, it's not going to really get digested too well. So what we use Portia for, we take off the cover to her fistula. So normally it's covered and sealed nice and well. We take that off, and we can get rumen samples from her, which have all the bugs that are necessary to keep the other sick animals' digestive tracts going. So we reach in nice and deep here so you can get a good sample. Down towards the bottom is more fluid than the top. The top is more of the fibrous material because it floats. So if you reach in and grab some, see all the juices coming out here? And we take this bucket and strainer here, and we squeeze off all of the juices through the strainer and into the bucket. So normally you want to fill up about half a bucket or a bucket depending upon the animal that you're doing this with. The actual process is called a transfaunation. We're taking the fauna from her stomach and putting it into another animal's stomach. So we take the juices that we get, which are in the bottom of this bucket, and we take this feeding tube here, and we go into the hospital, and we pass the feeding tube into the sick animal along with the juices and maybe some alfalfa pellets to sort of jumpstart their digestive tract and give them all the bugs that have died in their stomach to get their digestive tract going again. Portia has had this fistula in since 2002. It was done as a standing surgery, local anesthetic, some antibiotics, some pain medication. The scar tissue forms around it. There's really no nerve endings in it or anything like that, so she doesn't feel the fistula in her. It doesn't make her sick. It's not going to change her life expectancy. It doesn't really need any maintenance. The only thing that we do is sort of clean off the stuff that seeps out the bottom